everyone. Yesterday we went through the theoretical background and knowledge sharing of assisted bathing. So today I'm going to show you the backside, the practical role play for the assisted bathing. So before you do the assisted bathing, you need to prepare first. So what are we going to prepare? You prepare all the materials you need first. So these are the things we are going to use for the assisted bathing. For example, like towel, the clothes, toothbrush, the face wash if any, and then the shower gel. So some of the residents may feel allergic or they may feel sensitive to some ingredients of the shower gel, so they may have their own dedicated shower gel. So you make sure you check first before each resident if they have any dedicated shower gel they are using. And then they may also have the medicated cream or shower or like the shampoo for the scalp or the skin infection. The doctor may prescribe the medicated one, so you also check this one if they are using, then you make sure you use it. And then after shower, you may use the moisturizer or lotion for the dry skin. The doctor may also prescribe the moisturizer or lotion, so you make sure you use it also. And then some of the cases they may use the deodorant, so you make sure you also use all these individualized resident by resident for their particulars. And then you make sure the commode chair are well functioning. You make sure the commode chair well functioning, also the seat belt can be securely fastened. And then you make sure all four wheels of the commode chair must be locked together. And then you make sure the full privacy of the patient, which is you close the windows of the room, also the windows of the toilet. And then if there's any cuttings, you make sure the cuttings are drawn for the full privacy. And then you off the fan, and then you make sure the resident is comfortable, and if there's any want to touch the fever, like the sleepy, weakness, pale skin, abnormal breathing, something like that, you access first. And then you make sure you turn on the water heater before you going to shower the patient. Okay, we are going to give assisted showering to the resident. So before you prepare yourself first. So you wear the apron, mask, glove, or the footwear if any. It depends on the place where you are, and then it depends on the protocols you are using. Okay, now we are going to give assisted bathing to the residents. Before we do, you prepare yourself first. So you wear the apron, mask, glove, and the footwear if any. It depends on the place where you are and the protocol you are using, because some of the nursing home they may not use the glove while you give the assisted showering. So it depends on the protocols and it depends on the place where you are. And then you do 7 steps of medical hand hygiene thoroughly. And then it's always a good idea to explain whatever the procedure you are going to do to the residents. Even if they cannot communicate back to you, it's always a good idea to explain them what you are going to do. If you don't, they may feel scared or frightened, and then they may feel uncomfortable with the procedure you are doing. So always remember to explain the patient that what you are going to do. Okay, now we start. Hello Angel, good morning. I'm your nurse to take care of you today. And now it's shower time. So we are going to shower together. I'm assist you. So I know that you cannot shower independently on your own, and it's totally fine. That's why I'm here to assist you. So before, please let me check your skin condition, everything before we go to the assisted showering. Okay? So you don't have any fever, not want to touch. You feel any uncomfortable in the abdomen? No, right? You're okay? Everything okay with you, right? So please let me check the skin condition. Let me check the pad if there's any skin tear, infection, and I check all the skin condition. If there's any wound, any wound dressing, it must be covered properly. And then okay, everything okay. So we are going to go for the shower time. So I'm going to transfer you from the back to the commode chair. Before I make sure the commode chair is all wheels are locked, and then the seat belt can be fastened securely. Okay, please can help me to transfer for the back. So you may take some time for the resident to rest a while because they may feel dizzy while getting up from the back, and then you may take a while, and then you make sure you transfer gently from the back to the commode chair. So this is another topic for the transfer method and the good body mechanism, which I'm going to train you for the next section. So I'm going to transfer from here to the commode chair. So you make sure the resident is positioned and placed on the commode chair securely, and then don't forget to lock all four wheels and then fasten the safety belt, and you make sure the foot are rest properly on the footrest, and then you make sure the resident have the full privacy. You make sure the windows are closed, and then if there's any curtains, you draw all the curtains for the privacy, and then you make sure before you go into the bathroom you turn on the water heater. So for privacy things, the resident, the lower cloth of the body can undress at bedside, but you make sure they have it is covered with the towel. And always remember the top cloth of the residents cannot undress at bedside. You must undress the top cloth only in the bathroom or toilet. Okay, then we make sure the water heater is on already, then we go into the bathroom. Okay, you always remember we must spend time to the residents at least 5 to 10 minutes for showering, and please do not rush for assisted showering. Please do not rush. So you make sure the temperature is not too cold, not too hot. So you test yourself on your skin first. You test the temperature of the water on the wrist or elbow, and you can also ask the resident to test the temperature if he can cooperate also. And then you make sure you spread all the shower gel to every parts of the body, especially you take care of the skin fold like armpit, the breast fold, abdominal fold, the private area, everywhere you spread all over the body for the shower gel, and then you rinse off. There, you always remember if the patient can participate, you let them participate as much as they can, because we really encourage them to participate in the procedure we are going to do. So, and then you help with the scalp with the shampoo. You at least spend 20 seconds to spread the shampoo, and then you rinse off, which means you must clean properly and totally for the shampoo or the shower gel also. There should not be any residue of the shampoo or shower gel, because later on it may have effect on the skin like skin infection or scalp infection. Okay, after we properly giving assisted shower to the resident, please do always remember we must dry properly to them also, because the skin infection may come from there if we are not we haven't dried the skin very well or properly dry the skin the resident. So we make sure the dry the resident well with a towel, and then at the same time you assess the skin condition of the resident again. If there's any bruise, infection, the tears, or the fungal infection or rashes, you assess the skin thoroughly again. And then you must dress the top clothes of the resident in the bathroom, because as I mentioned before, the top clothes must dress or undress only in the bathroom. So you make sure you change the new clothes in the bathroom for the top part, and then you make sure you cover the lower part of the resident with the towel. And then you gently move out the resident to the bedside, and then again you transfer gently the resident from the commode chair to the bed again. You make sure you position the resident comfortably, gently and properly in the bed, and then you do all the things. You dress the lower parts of the body, you finish everything, and then you don't forget to pull up the bedside rail for the safety of the patient. So if you finish the assisted bathing, the procedure totally, and then you can remove the mask, glove, the footwear, the apron, everything, and you throw to the dustbin. And then you do again the 7-step or medical hand hygiene before you move to another residence. So these are the tips for the assisted showering to the resident. You make sure you shower the resident and spend the time with the resident for showering at least 5 to 10 minutes. And then you make sure you spread the shower gel all over the body, especially you take care of the skin fold, for example like the armpit. For female patient, the breast fold and the abdominal fold and the private area, the gluteal part, the perineal, and then you make sure the groin area, and then you make sure the whole body is properly clean. And then you make sure the patient has no skin tear or wound and bruises or skin rashes, skin infection that you need to assess during your showering time. And then you make sure you apply the shampoo. If the resident have any medicated shampoo, you make sure you use it. You spread the shampoo all over the scalp. At least you spend 20 seconds and then you rinse off, which means you must be totally clean of the shampoo. There should not be any residue of the shampoo or the shower gel on their body or scalp, because later they may get skin infection and the scalp infection from there. And then you always remember to make sure the commode chair always must be locked whenever it is stationary. And this is the take-home message for you for assisted showering. Always remember the 3 C of safe bathing: communicate, concentrate, and collect. Okay, what to collect? Collect all the materials you need to use during the assisted showering, and then concentrate, which means you must pay attention and focus the resident at all time whenever you are doing the assisted bathing. And then communicate, which means you must be communicate to the resident what you are going to do, so they understand what you are going to do to them, which make them calm and comfortable, so you can do easily for all the procedure you are going to do. And then you always remember to make sure, do not rush, please. Do not rush the patient for showering and take your time. And then one more important thing is you make sure the patient have full privacy at all time. And then you make sure the patient's safety, and you always put the safety first. Never leave the patient unattended. Even for the normal patient, you never leave the patient unattended, because accident can happen at any time, anywhere, any situation. So you make sure the patient's safety, and then always remember you strictly follow the protocols.